Hi, I'm Dr. Fareen Karachiwala, Associate Medical Officer of Health for York Region. I am very happy to share that we have now vaccinated almost 80% of York Region residents age 80 plus with at least one dose, and most eligible healthcare workers who work or live in York Region. In total, we have given over 100,000 doses between public health and our partners locally. Hitting these milestones is encouraging, and the light at the end of the tunnel gets just a little bit brighter every day. York Region continues to move forward to the next priority groups as quickly as possible. Most recently, we opened appointments to residents age 75 to 79 ahead of the provincial start date. We are expecting to receive roughly 60,000 doses of vaccine each week for the next 2 weeks. So we hope to complete the 75 plus age group in about 7 to 10 days, meaning we could open appointments to the next age group soon, continuing to move down the age groups in 5-year blocks. People previously identified as being eligible to receive a vaccine, but who have not yet booked an appointment, are still able to do this. And we very strongly encourage it, even if we've moved on to a next eligible group. You can book and find information at york.ca/COVID-19 vaccine. Working with community partners, local hospitals, and the Central LHIN, York Region will begin vaccination of homebound individuals and people receiving home care this week. There are more than 3,000 homebound residents in York Region, so it may take some time to reach all of them. We continue to ask for your patience as we work to get vaccines to those who can't as easily come to a clinic. We also recommend that homebound residents, or those receiving home care, to consider booking an appointment at one of our drive-through clinics if you can attend. Last week, we had a test run of the drive-through clinic at Canada's Wonderland. What we have learned will be used to improve the process when the site officially opens on Monday, March 29th. Increased vaccine supply has also allowed us to open an additional clinic at the Annan Community Centre in the city of Markham this week. Community partner vaccine clinics in King and Stouffville are also expected to open in the coming weeks. A lot of people are asking how we have been able to make such good progress here in York Region. And it's partly because we started about 2 weeks earlier than most other jurisdictions, but also because of the Ministry of Health's recent decision to extend the second vaccine dose to 16 weeks, on the advice of a national body of vaccine experts. While we recognize that this means some people have to wait longer for their second dose than they thought, this decision does allow us to now give those doses as first doses, so more of the community at risk can be protected sooner. This is a very good thing because, as you know, the rates of COVID and rates of variants of concern are unpredictable right now. The quicker we can vaccinate the majority of people, the better off we can all be, and the sooner we might be able to get back to some of those activities we all dearly miss. Data from both clinical trials and real-world effectiveness have shown that people get very good protection from even just one dose of the vaccine, and that protection isn't expected to decline quickly. Also, this recommendation actually comes from the National Advisory Committee on Immunization, a long-standing expert group, and it's being followed in Ontario and other places in Canada as well. We know through years of data and learning about the principles of how vaccines work that stretching out the time interval of a second dose is unlikely to interfere with protection. In fact, it's the opposite. Getting a dose too early is where problems with protection come into play. And with some of the approved vaccines, like AstraZeneca, for example, stretching out the interval a bit longer actually helps with effectiveness in some cases. Many other types of vaccines, non-COVID ones like hepatitis B, for example, do have booster doses months or even years after the first dose. We know this pandemic has been hard on everybody, and understandably, people are eager to get their vaccines. Remember, this is the largest rollout of vaccines we've ever experienced across the world. And so things will evolve, and guidance and recommendations are expected to change and adapt as we learn more. So please be understanding and patient. We will get to everybody. Also, very importantly, and I cannot stress this enough, even if you have gotten your dose or doses, you must continue to follow public health recommendations like masking, respecting the gathering limits, maintaining distancing, until the majority of our community is protected. There is still quite a journey to get to the high vaccine rates we need for all to possibly benefit. So please continue to be vigilant and play your part. We don't want to take any steps backwards because we've come such a long way. Lastly, I want to remind people to please be kind, not only to one another, but also to those staff who are supporting York Region Public Health and serving the community. It's been really upsetting to see a rise in disrespectful and inappropriate behavior towards our staff, who are working literally day and night to do everything they can to support people, on the phones, in the clinics, or on the streets. They want the best for everybody and are trying to help in any way they can. We are all trying our very best and will continue to do this for our communities and our families that we value so much. Please remain respectful and constructive. Thank you, and stay safe and informed. You can visit us at york.ca/COVID-19 for any more information you may need.